Hello everyone, this is my presentation on the flower show, and this is case study number 32. For my first question, the syndrome question, I had suspected aspergillosis in my patient. My patient's name is Wilhelm, and Wilhelm Bosch is a 34-year-old landscape designer who presented to his local physician 3 days previously complaining of fevers, malaise, and vague respiratory symptoms. He was given amantadine for suspected influenza, and sadly his condition became progressively worse, which continued with shortness of breath. And his hospital admission, the initial examination revealed that his temperature was 40 degrees Celsius, his pulse was 135 beats per minute, his blood pressure was 130/95, and he had 30 respirations per minute, and his chest examination was noticeable for decreased breath sounds by auscultation and dullness to percussion. During the conversation with the patient, it is found that there is a shared common interest, flower gardening, and particularly tulips. The patient enthusiastically described a flower show that he had recently attended in the Netherlands with hundreds of variety of flowers that were artistically presented among numerous water features, ponds, fountains, and waterfalls. And so, with this information, the patient presents with high fever, high respiration rate, slightly high blood pressure, decreased breath sounds, and dull percussion. For my question number 2, which is the differential diagnosis, I had two suspects that were my main suspects, and they were bacteria and fungal. And for my bacteria, I had suspected that it was Streptococcus pneumonia or Pseudomonas aeruginosa. And for the fungus, I had Aspergillus niger and, excuse me if I butcher this, but Coccidioidomycosis. And for the viral, I had no suspect because my patient was proved to be resistant to antiviral medication because he was misdiagnosed with the flu, and the medication didn't work for him. And for the parasite, I had no parasite suspected, and that's because my Willem is a 34-year-old patient who had no signs or history of arthropod bites, and he was recently exposed to many different types of plants, especially flowers, that are known to give off certain fungal infections, and that is why I had been led to believe that it was a bacteria or a fungal infection. For my questions 3 through 6, I had a few sample requests, and so for mycology, I had sputum test, antibody detection, which was the calcifluor white stain. For bacterial, I had respiratory antibody screen. Hematology, I had a full blood cell count test, and that would be the white blood cells, the red blood cells. Radiology, I had a chest x-ray for possible signs of pneumonia. And what it ended up being, I ended up getting a sputum and a blood test. And the sputum test was the bacterial test, the respiratory antibody screen. And it ended up showing positive for gram-negative bacilli, for blood, chocolate agar, and the BCYE, but no growth on the McConkey. And the blood test for the fungus had no growth, which I was thoroughly surprised with because I had a very strong belief that this was a fungus due to his liking of tulips, which disseminate spores that can cause aspergillus. Here are the results for my PCR. Sadly, the 2 tests that I did for my PCR did not end up being the final result, and it was neither pneumonia or the aspergillus. Looking back at this result now, it is totally possible seeing this because Legionella pneumophila can be spread through contaminated water, which, ding, 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 all of these waterworks at his flower show, the waterfalls, the fountains, they could most definitely be contaminated water. So again, in my question 8, the results from the serology lab, the respiratory sputum screen for Legionella pneumophila, the antigen titer was over 0.19 over the 0.9 that determines whether or not it is the antigen. And the lab technician note on this was actually the antigen detection is below calcifluor white stain was negative for fungi. So that means that it is completely ruled out that it was a fungi, and that it is definitely Legionella pneumophila that my patient Willem has. So the question number 8, prognosis and treatment of Legionella pneumophila. The treatment of a typical person with Legionella pneumophila is antibiotic treatment for 3 to 10 days, depending on how bad the infection is. Now, Willem has been misdiagnosed with the flu, which means that he has had symptoms, and his symptoms have worsened over time because he has been giving improper treatment. And this gives me reason to believe that he will either need 3 to 10 days or even longer on antibiotics. And some antibiotics that would do well with this infection are macrolides, which is azithromycin, or quinolones, which are ciprofloxacin, levofloxacin, moxifloxacin, gemifloxacin, and trovafloxacin. And with my patient's prognosis, he is relatively young, and with proper usage of antibiotics, they should take effect within 24 hours of starting them, and he will have a full recovery. And the only thing is that some things that Legionella pneumophila can cause are pneumonia, Legionnaire's disease, Pontiac fever, and all of which can potentially make your prognosis time longer.